Imagine having, like, X-ray vision,
Mm-hmm.
being able to look deep inside the human body without making a single cut.
Yeah, it sounds like a superpower, doesn't it?
It really does. But this incredible ability, well, it's a cornerstone of modern medicine. We rely on these non-invasive eyes to see what's going on inside.
Absolutely. It fundamentally changed how we diagnose and treat illness. We went from, educated guesses to actually seeing the problem.
And that brings us straight into our deep dive today. We're exploring the world of radiology, that whole medical specialty focused on using imaging.
Mm.
We've got a whole stack of sources that you've shared covering, well, just about everything from the very first discovery right up to the super high-tech stuff.
Yeah, and our goal here is really to unpack these sources with you. We want to break down all the different ways doctors can visualize the inside of the body.
So how they work, what they're used for.
Exactly, and what makes each one, unique. Think of this as your fast track to getting a handle on this fascinating field. It touches so many lives.
Okay, let's jump right in. The sources start with the basics. Defining radiology. What's the core idea?
Well, at its heart, radiology is the medical specialty using imaging tech for diagnosis, yeah, but also monitoring and sometimes guiding treatment too. It's not just taking the picture.
Right, it's the interpretation as well.
Precisely.
And your sources point out pretty quickly that there are two main branches here.
That's right. You've got diagnostic radiology first. That's purely about using the images to figure out what's wrong. Diagnose conditions like a fracture or a tumor, maybe
Right.
an infection.
Okay, diagnosis. And the second one?
That's interventional radiology. Now, this branch uses imaging, often like in real time.
Like a live feed.
Exactly, to actually guide minimally invasive procedures.
Wow, okay. So they're using the scans almost like a GPS to steer tools inside the body. That's a big shift from just looking.
It is. It moves from just diagnosis into actual treatment. And
Yeah.
the sources are really clear. This isn't just one person. It's a whole team. You've got the radiologist, who's the medical doctor, interpreting the scans, writing the report. But you also have radiographers, sometimes called technologists.
They're the ones running the machines.
Yes, the skilled pros who actually acquire the images. And nurses, of course, play a huge role in patient care throughout the whole process.
It's fascinating how, relatively speaking, young this field is. I mean, it really just exploded onto the scene a bit over a century ago.
Yeah, if you look at the origins in your sources, it pinpoints a specific date. November 8, 1895, Wilhelm Conrad Röntgen discovers X-rays.
And the impact was just immediate.
Yeah.
Right, revolutionary. Your sources mentioned that within, 10 years, it was already being widely used.
And Röntgen got the very first Nobel Prize in physics for it in 1901. That speed just tells you how fundamental it was.
It really changed everything.
It really did. And the sources touch on other key figures, too, like Marie Sklodowska-Curie, who saw the need for imaging right on the battlefield.
Oh, right, in World War I.
Yeah, she pushed for mobile radiography units, the Petites Curies. And then there's Joseph Gilbert Hamilton, who was an early pioneer using radioactive isotopes like iodine, which kind of paved the way for nuclear medicine.
So from that one discovery, this incredible toolkit emerges. Let's dig into these tools, the ones covered in your sources, how they work, what they show us.
Okay, let's start with the foundation. The basic X-ray, projection radiography, technically.
Right. How does that actually let us see inside? What's the principle?
Okay, so an X-ray machine sends a beam, a low dose of radiation through the body. Now, different tissues absorb or scatter those X-rays differently, depends on their density. Bone is really dense, right? So it absorbs a lot, and it shows up white on the image. Air, like in your lungs, is not dense at all, so more X-rays pass through, and it looks dark.
I see.
The radiation that makes it through hits a detector. Used to be film, now it's mostly digital, which your sources mention is way faster and easier to work with.
So it's basically like looking at a shadow based on how solid things are inside you. What's it best for, typically?
It's the real workhorse for quick checks. Diagnosing bone fractures is a classic, looking for signs of chest infections, pneumonia, TB, dental issues, finding swallowed objects.
Common stuff.
Yeah. And then there are specific applications like mammography for breast cancer screening and DXA scans, that stands for dual energy X-ray absorptiometry, that measures bone density for osteoporosis. They're all based on X-ray tech.
The pros seem pretty clear. Quick, usually affordable, painless, non-invasive. Are there major drawbacks?
Well, the main one is it uses ionizing radiation. It's a low dose for standard X-rays, but it's still radiation. And crucially, it doesn't give you great detail for soft tissues, not compared to other methods anyway.
Okay, so building on X-rays, your sources bring up fluoroscopy. How is that different? What does it let doctors see?
Fluoroscopy is like a specialized X-ray. The key difference is it provides real-time visualization. Think of it like watching an X-ray movie, basically.
Oh, wow. So you can actually see things moving, structures, processes.
Exactly. And often they use contrast agents, things like barium or iodine that you might swallow or get injected, maybe rectally.
To make things stand out.
Right, to highlight specific structures like your digestive tract or blood vessels, the urinary system. It lets doctors watch dynamic things swallowing, food moving through your gut, that's peristalsis, blood flowing. Sometimes even air or CO2 can act as a contrast.
That's clever, adding function to the structure. Okay, stepping up in complexity now. CT scans, computed tomography. How does this go beyond a standard X-ray?
Right, so a CT scan takes that X-ray idea and really ramps it up. You have an X-ray tube, but it rotates super fast around the patient. It takes hundreds, maybe thousands of images from all different angles.
Okay.
Then a powerful computer crunches all that data and reconstructs it into cross-sectional slices of the body. It's like digitally slicing through you and looking at each layer. It can build detailed 3D images too.
Slices, that makes perfect sense visually.
Yeah.
What's the big advantage of CT, especially, say, in the ER?
The key things are its speed and those cross-sectional views that a plain X-ray just can't give you. That makes it absolutely invaluable in emergency rooms for trauma patients.
Right.
It's fantastic for quickly spotting internal bleeding, getting detailed views of bone injuries, checking lung problems, finding many types of cancers, blood clots like PEs or strokes. Your sources really emphasize how CT revolutionized diagnosing urgent stuff. Things like appendicitis or kidney stones, which might have needed exploratory surgery before, are now often diagnosed really fast with CT.
That's a massive impact on urgent care. So fast, cross-sectional, great for bone, great for bleeding. What are the downsides?
Well, it definitely involves a higher dose of radiation than a standard X-ray. That's a key consideration. And while it's great for many things, the detail you get for soft tissues, well, it's not quite as good as what we'll talk about with MRI.
Okay.
Though your sources do mention advances like spiral multi-detector CT, which makes it even faster and gives better detail.
Got it. So radiation is the factor with X-ray and CT. Now, ultrasound, how does that work? Is radiation involved there?
No, ultrasound is totally different. It uses high-frequency sound waves, no radiation at all.
Okay, sound waves. How?
There's a handheld device, a transducer. It sends these sound waves into the body. When the waves hit different tissues or organs, they bounce back like echoes. The transducer listens for those returning echoes, and a computer processes them into real-time images on a screen.
No radiation's a huge plus, right?
Yeah.
Especially for some patients.
Absolutely. It's considered very safe, which is why it's the go-to for monitoring pregnancies. It's also really good for looking at soft organs, heart, liver, kidneys, bladder, assessing blood flow using something called Doppler, guiding procedures like biopsies or draining fluid. And in trauma, it's used for a quick check for internal bleeding called a fast exam.
So safe, real-time. What are the catches? What limitations do the sources mention?
Generally, the resolution, the level of detail isn't as high as CT or MRI. And sound waves, well, they don't travel well through air or bone, so it's not great for looking at things hidden behind bone or organs filled with gas, like the lungs or parts of the bowel. Also, the quality of the scan can depend quite a bit on the skill of the person doing it, the sonographer, and also things like the patient's body size. But, like the sources say, there are advancements like 3D and even 4D real-time ultrasound that are always improving things.
Okay, so we've got radiation with X-ray CT, sound waves with ultrasound. Next up, MRI, magnetic resonance imaging. This uses powerful magnets, radio waves. Can you break that down? How does that see inside us?
Yeah, this one's quite different again. It uses incredibly strong magnetic fields. These fields make the hydrogen atoms in your body, which are mostly in water molecules, and water's everywhere and you line up in a certain way.
Okay, they all line.
Right. Then the machine sends brief pulses of radio waves into the body. These pulses knock the hydrogen atoms out of alignment.
Temporarily.
Exactly. When the radio wave pulse starts, the atoms relax back into alignment with the magnetic field. As they relax, they give off tiny signals. The MRI scanner has receiver coils that detect these very faint signals.
And the computer.
The computer takes all those signals and translates them into incredibly detailed images.
So it's listening to your hydrogen atoms reacting in a magnetic field, basically. What's the real standout feature of MRI? Why use it over the others?
What really sets MRI apart, in your sources highlight this clearly is its amazing soft tissue contrast,
Yeah.
meaning it gives incredibly clear, detailed pictures of things like the brain, the spinal cord, muscles, tendons, ligaments, many internal organs, structures that are just hard to see well with X-ray or even CT sometimes. It's brilliant at showing subtle differences within soft tissues.
Wow.
Plus, it can easily create images in any plane slicing you crossways like CT, axial, or front to back, coronal, or side to side sagittal, even oblique angles, all with great clarity.
Okay, best soft tissue detail, no radiation exposure.
Hmm?
Those sound like huge advantages. What are the challenges, the limitations?
Well, it's generally more expensive than other scans,
Ah,
and it can be pretty uncomfortable for the patient. The machine is very noisy.
right, you hear about that, like loud banging.
Exactly, you need ear protection. And the space inside the scanner, the bore, is often quite tight. This causes significant anxiety, even claustrophobia in some people. Your sources mention maybe up to 5% have severe issues.
It's quite a lot.
It is. And crucially, those powerful magnets mean it's dangerous for people with certain metal implants, older pacemakers, some types of clips used for brain aneurysms, cochlear implants, even tiny metal fragments may be in their eyes from an old injury.
Safety screening is vital.
Absolutely critical. And patient movement is also a problem. It can blur the images, and the scans can take a while.
Are they making progress on the comfort side?
Yes, definitely. There are efforts. Stronger magnets, like 3 Tesla ones, can mean shorter scan times. There are scanners with wider openings or shorter tunnels. More open MRI designs exist too. But the sources do point out there's often a bit of a trade-off. Sometimes the most open designs might compromise a bit on the absolute highest image quality compared to a traditional high-field closed bore.
Okay, that makes sense. So we've talked about technologies that mostly show a structure, right? The anatomy. What about looking at function, how things are working?
Ah, good question. That's where nuclear medicine really comes into play. This includes things like PET scans and SPECT scans. The approach here is fundamentally different. Instead of sending energy into the body and seeing what comes out,
You put something in first.
exactly, you administer a tiny, safe amount of a radioactive material. It's called a radiotracer to the patient, usually injected, sometimes swallowed.
A radioactive substance, how's that work?
Well, these tracers are specifically designed molecules. They're tagged with a radioactive isotope, and they're made to go to specific places in the body or get involved in certain biological processes.
Like what?
For example, FDG, which is super common for PE scans, is basically a glucose molecule with a radioactive tag. So it naturally goes to tissues that use a lot of glucose, like active cancer cells, or your brain when it's working hard.
Okay, so the tracer goes where the action is. Then what?
Then, specialized scanners, like a gamma camera for SPECT or a PET scanner, detect the radiation that's being emitted by the tracer from inside your body. This shows where the tracer has accumulated and how much is there.
So what unique information does that give doctors?
It gives functional or metabolic information, not just structure, but how your organs and tissues are actually working at a cellular level. This is incredibly powerful for detecting diseases early because sometimes changes in function happen before you can see changes in structure.
Ah, I see. So early detection is key here.
Yes, it's vital for finding cancer and seeing if it's spread metastasis. Also for evaluating heart disease, looking at blood flow and function, and for brain disorders like investigating Alzheimer's by seeing patterns of metabolic activity.
What about the practicalities? Downsides?
Well, there is radiation exposure involved, typically more than a CT scan, though the doses are carefully calculated and considered safe, and the tracer clears from the body fairly quickly. These scans can also be more expensive and often take longer than, say, an X-ray or CT. But a major advancement your sources highlight is the ability to fuse these nuclear medicine images with CT or MRI scans.
Oh, overlaying them.
Exactly. You combine the functional map from the PET or SPECT with the detailed anatomical map from the CT or MRI. This helps pinpoint abnormalities with much greater accuracy. You see where something is and how it's behaving, all in one image.
That fusion sounds incredibly powerful, like getting the best of both worlds.
It really is. It provides a much more complete picture, especially in complex cases like cancer staging.
We touched on interventional radiology right at the start. Can we circle back and expand on that a bit? How does this specialized field use all these tools we've discussed?
Right. Interventional radiologists, or IRs, are doctors who use these imaging techniques, fluoroscopy for that real-time X-ray, CT, ultrasound, sometimes MRI, not just to diagnose, but to actively guide tiny instruments inside the body to treat conditions.
So instead of cutting someone open for surgery, they're navigating inside using the scans as their eyes.
Precisely. They can reach deep inside the body through very small openings, often just a tiny nick in the skin.
What kinds of procedures are we talking about?
Oh, a huge range. Things like using catheters and wires to insert stents to open up blocked arteries or veins, treating aneurysms by placing coils or stents, draining abscesses or fluid collections, something called embolization, where they block the blood supply to tumors or bleeding points, or performing highly targeted biopsies, getting tissue samples with pinpoint accuracy.
And the big plus for the patient is?
It's significant, and the sources really stress this. These are minimally invasive procedures. That usually means no large surgical incision, which translates to less pain, a much faster recovery time, and shorter stays in the hospital compared to traditional open surgery. The whole idea is to fix the problem with the least amount of trauma to the body, all guided by sophisticated imaging.
It's pretty amazing how imaging transforms these complex internal problems into procedures that can be done so precisely. Now, you mentioned the team earlier, the radiologist, the technologist. Let's focus a bit more on the radiologist. Once the scan is done, what's their specific role?
Okay, so radiologists are medical doctors, MDs or DOs, who've done years of extra, highly specialized training focused entirely on interpreting these complex medical images.
So they're the image detectives, essentially.
You could say that. Their main job is to analyze the scans, identify anything abnormal, and then write a detailed diagnostic report that goes to the patient's main doctor, the referring physician or surgeon. They're critical collaborators, helping other doctors decide on the best course of action based on what the images show.
Do they do more than just interpret?
Oh, yes. They might perform some of the procedures themselves, especially the interventional radiologists we just talked about. They also use imaging to track how well a treatment is working over time.
How much face time do radiologists typically have with patients? Does it vary?
It varies a lot, as your sources note. Some radiologists, maybe those specializing in reading scans sent electronically from other locations, that's stellar radiology, might have very little direct patient contact.
Right.
But others, especially interventional radiologists performing procedures, obviously interact a lot with patients, explaining things, doing the procedure, follow-up. And even diagnostic radiologists, who spend a lot of time in reading rooms looking at screens, are often the ones responsible for explaining the specific risks and benefits of an imaging test or procedure to a patient to get their informed consent. They're the experts on the imaging itself, after all.
And becoming one. It sounds like a long road.
It really is. It's extensive and very competitive. You're looking at 4 years of undergrad, then 4 years of medical school for the MD or DO degree, then a year of internship, then 4 or 5 years of dedicated radiology residency training. And even after all that, many radiologists go on to do another 1 or 2 years of fellowship training to subspecialize in a specific area like neuroradiology for the brain and spine, or pediatric radiology, musculoskeletal imaging for bones and joints, cardiac imaging, becoming true experts in one niche.
And the radiographers, the techs, taking the pictures.
They also need significant specialized training and usually hold degrees as well. It's a highly skilled profession.
It's definitely clear this field doesn't stand still. Looking forward, what are the big trends? What does the future look like for radiology, based on what's in your sources?
Yeah, radiology is right at the cutting edge of medical innovation. Your sources point to a few key trends. One huge one is artificial intelligence, AI.
The robots taking over.
Not exactly. It's more about AI tools assisting radiologists, helping them work more efficiently, maybe flagging potential subtle abnormalities on scans faster, or helping quantify things like measuring tumor size consistently, making the expert human even better.
Okay, AI is an assistant. That makes sense. What else?
Another really cool area is using the scan data, like from a CT or MRI, to create physical 3D printed models of a patient's actual anatomy.
Like a model of someone's heart or a fractured bone?
Exactly. Surgeons can then hold this model, examine it, plan their approach with incredible precision before they even go into the operating room.
That's fascinating.
And then there's the push towards more portable imaging. Especially with ultrasound, we're seeing smaller, even handheld devices. This could really expand access to imaging in remote places or bring it right to the patient's bedside in the hospital or clinic.
So bringing it all together, what does knowing about all these different techniques really mean for you, the person listening right now?
Well, hopefully it gives you a much deeper appreciation for just how powerful and sophisticated modern medical diagnosis has become.
Yeah, and maybe helps you understand why your doctor might order one specific scan over another. You know, why they'd choose an MRI if they suspect a spinal cord issue, or a CT if there's concern about internal injury after an accident, or an ultrasound during pregnancy.
Exactly. And maybe, just maybe, knowing a little bit more about how these machines work and what to expect might make you feel a bit more informed, maybe a little less anxious, if you ever need one of these tests yourself.
These sources you share, they really give such a solid grounding in the core ideas and the technologies that let doctors see the invisible inside us. It's like pulling insights from physics to map out our internal world.
Absolutely. From that game-changing discovery of the X-ray over 100 years ago, through CT's cross-sections, safe ultrasound, super detailed MRI, functional nuclear medicine, and those image-guided interventions, we've really traced the evolution of tech that's just fundamental to healthcare today.
So let's leave you with a thought to mull over. As this imaging technology just keeps getting faster, more detailed, smarter with AI, even more portable, how do you think this will keep changing our relationship with health and disease?
Yeah, could it push us towards even earlier, more precise, maybe highly personalized diagnosis and treatment for everyone? What new possibilities or even what new questions does this constantly evolving picture raise for you?
We hope this deep dive into your sources has given you plenty to think about.
And maybe spark some curiosity to keep exploring this amazing world of medical imaging.